The Accra Psychiatric Hospital is in dire need of major rehabilitation. The hospital, since its establishment in 1904, has seen very little rehabilitation works, thus putting pressure on the limited facility at the centre. Aside the poor facilities at the centre, there are also the challenges of social ostracisation when one visits the facility to access mental health care. The situation has led many to suffer in silence. It is to address this trend that the Mental Health and Wellbeing Foundation, in conjunction with the Australian High Commission, through the Direct Aid Programme scheme, took the decision to offer rehabilitation services to the hospital. Officials choose to rehabilitate one of the already established wards at the hospital into a VIP ward to enable anyone seeking mental health care yet wants to be hidden from the prying eyes of society to do so with ease. The VIP ward, when completed, will come with upgraded services not available at the normal wards. The wards will also be complete with special doctors and is basically targeted at persons who can afford to pay for the services rendered there.
It depends on what your conditions are. So, of course, based on the assessment that they make of you and what you require, they'll give you the options as to what is available. And you, as the client nowadays, per the Mental Health Act, you may need to choose what. You have a choice. You have to make an informed decision. And I think that is going to be one of the opportunities given to them. There is always the medical aspect of things, which is normally what is promoted. But now there is a shift towards rehabilitation and support and wellness. And I think this board, we hope, will provide those alternative services.
Country Director of the Mental Health and Wellbeing Foundation, Dr. Gina Teddy, dispelled the notion that anyone visiting a psychiatric facility will be sedated and put on medication. According to her, VIP patients will be eligible for the option of rehabilitation dependent on their assessment. The VIP ward is sectioned off for the well-to-do in Ghanaian society to come and relax in order to re-energize themselves.
Somewhere that you feel that you want to hide out, not necessarily being in the hospital, in a hospital facility, but also just somewhere that you can come and then take care of your wellness. Probably you are overstressed, you need some healthcare per se to help you, but you need some form of, rejuvenation of yourself. So you come in here, and I think that's to create that platform. I think the idea today is that mental illness is not going to be only based on medicine. There should be some form of rehabilitation programs.
According to the Australian High Commission, they have invested 38,914 Australian dollars into this project. The High Commission also funded the renovation of the female acute ward washrooms. Officials of the Accra Psychiatric Hospital bemoaned that even though the 2019 grants from the government for mental health were starting to come through, it was still a little slow for them as there was still a lot of work to be done. The VIP ward will join the pharmacy, laboratory, electroconvulsive therapy department and the OPD, sources of internally generated funds for the hospital.
This is a hospital that has a lot of needs. So when you collect the funds, there are other urgent needs that you have to use funds for. So over the period, we have not been able to maintain a status, and that is why there's a need for us to renovate it as of now. We have our plan to renovate many of the departments, but the fact is that we don't have the funds available enough to renovate all of them. So we prioritize and we renovate the ones that we can, and we seek the support of other organizations like Mental Health, Wellbeing and Foundation.
Work on the project is expected to be completed in 3 months' time. Though the contractors assure the hospital that with the cooperation of the hospital staff, they will be able to finish the works ahead of time.